Testosterone replacement is one of the areas of integrative medicine that we actually already have a lot of experience with. We've been doing testosterone replacement here at Quick Care since about 2008, and I can tell you we've seen some tremendous results with an awful lot of patients who didn't even know they had a low testosterone problem. Testosterone is one of those hormones in men which sort of declines normally with age. It's not really abnormal to have low testosterone when you're in your 50s or 60s or even a little bit younger. Even though it's not abnormal, doesn't mean it's healthy to have your testosterone at these low levels. What we've seen improve most dramatically with testosterone replacement is, surprisingly, not sex drive, not sexual function. It's really a general feeling of energy and well-being. So many men, as they age, feel blah, unmotivated, just kind of like to sit around rather than being really active and enthusiastic. And that's not necessarily just part of getting older. That could be low testosterone. And that's the thing we see most improvement with when people's testosterone levels are raised and normalized. We've done an educational video on this. Daniel Miller, who specializes in hormone replacement, is the presenter. Hope you find it interesting.
Low testosterone in aging males is way more common than we used to think, and it really does affect a man's quality of life. Everything from energy, mood, sexual function, and other complications can be negatively affected because of low testosterone, or low T, as they say on TV. Men will reach their highest testosterone level around 18, followed by a slow 1% decline each year on average. But some guys reach a lower peak level at 18 than others, which means those men will be deficient at a much younger age. Other factors can also cause a quicker drop in testosterone, like drugs, genetics, lifestyle, obesity, and chronic diseases. In fact, diabetics have far higher rates of low testosterone than non-diabetics. Interestingly, when diabetics get testosterone replacement, their blood sugar improves. Good side effect, right? Low testosterone symptoms can vary from man to man. Some will get all of the typical symptoms, and some may only have a couple, like fatigue or depression. If you are experiencing any of these, it is a good idea to have your levels checked. Typical signs of testosterone deficiency can include fatigue, lack of motivation and drive, mood changes, less interest in hobbies and previous interests, increased need for sleep, erectile dysfunction, decreased libido, less excitement for life, muscle weakness and decreased muscle mass, weight gain, joint stiffness, memory decline, brain fog and poor concentration, and I just don't feel like myself anymore. Studies have shown low testosterone levels to be associated with increased risk of numerous health issues such as heart disease, diabetes, high blood pressure, high cholesterol, increased inflammation, Alzheimer's and dementia, osteoporosis, anemia, increased cancer risk, muscle loss and frailty, and also all-cause mortality. Some of the benefits of replacing testosterone include increased energy, improved mood and attitude, increased mental focus and sharpness, increased strength and muscle function, improved libido and erections, weight loss, improved cholesterol, improved blood pressure control, improved control of blood sugars, decreased inflammation, decreased risk of osteoporosis, and large improvements in quality of life. Working with a practitioner who's knowledgeable in testosterone replacement is essential to getting maximum results and avoiding side effects. Testosterone replacement is not as simple as checking a testosterone level and administering testosterone. Hormonal balance is always the goal of replacement. In fact, there are other hormones besides testosterone that require proper attention and balance to get the best results. There are different ways of replacing testosterone, and one size certainly does not fit all. Some men respond very well to one particular method, while others may not. We'll figure out what works best for you from a cost and convenience standpoint. Different modalities of testosterone replacement include topical gels and creams, injections, and also pellets. Low T can be devastating to a man's quality of life and long-term health. Any man interested in restoring or maintaining health, happiness, and vitality should have their levels checked. If you need testosterone replacement, we'll work with you to get it right and get you feeling better again.